Go to the bathroom and sit for a while and relax. Let it empty. Relax. And don't forget to breathe. Important. In my book, you will see this thing, the window to your brain. And I learned that from my patients because my patients would be sitting there and I would be observing, because that's what a doctor does 99% of the time. And as I am talking to them, the white of their eye is getting inflamed, injected, red. I observed. And then I observed the patient post-op. And it ain't getting red. Same thing, the idea of the box. It's got to go somewhere if it's stuck. So I've taught patients, and blepharospasm, for you, those of you who are wondering, blepharospasm means that your eyelid flickers. Tearing, all those things are part of that. Use your senses, relax. Positive thinking, go to church. If that's what does it for you, read, get empowered, meditate. You have the power, you can make it or break it, believe. If nothing works anymore, your whole brain has been hurt. You may not understand the extent of your problem, but you feel it. You feel that you go another year and you're going to be out. You feel like you're dying. But you're not dying because the brain doesn't kill, it maims. So it drags on and on and on, and pain and pain and pain and more drugs and more vicious cycle. The worst part is others don't see what you're complaining about, so you're not even believed. Can we help? Can neurosurgery help? Neurosurgery is the next frontier. President Clinton, I think it's him now, I'm not even sure of that, but whoever was there in the 90s decided that it was going to be the decade of the brain. And the government put money at NIH. I got to tell you something about that. Put money at NIH to help brain knowledge move along. Let's make the 2010s the decade of the brain, and let's move along. We can. By the way, I mentioned earlier to you that some surgeons that have ventured outside the box have been knocked down. But they don't knock down completely because they resurrect and they resurrect and they resurrect, because they're like me. They know what we know, what we know, what we know, and we're going to keep on fighting. Even if we are knocked, even if they take our house away from us, we will keep on fighting. Interestingly enough, that entity that I talked about, Chiari-1, that entity is being studied at a Chiari Institute in New York. And they're getting funded by NIH to study that. NIH, National Institute of Health. They're putting money to these guys to fund their surgery. But the other surgeons that are trying to do it out there on their own get shut down. Why? Because nobody in their neighborhood does it? That's what the standard of care is, your neighborhood. The whole brain. We're going to quit in a minute. Let's treat the whole brain, brain, heart, stop the blame game, stop the name game, start the learning game. That's the only thing that has value. Standard of care, fallacy, innovation. Who is going to fix healthcare? Tell me, who is going to fix healthcare? Obama? What does he do? What does he do to fix your healthcare? Who is going to fix healthcare? The government? The Congress? The president? Health maintenance organization who are just dipping in a pocket on their way? What kind of health do they maintain? You and your doctor or your health professional helps you maintain your health. Not them. The lawyers? Lawyers are very They are no different than us. They're compassionate. They see the patient hurt, and you know that our bodies were not meant to sustain the speeds of a motor vehicle accident. They're not meant to do that. It is too much. Yes, I'm going to conclude. And therefore, they have a role to play. But they cannot prevent the progress of health care by knowledge. And we must stop any hindrance to knowledge. Free the doctors. Just like any other technologies, we will deliver the technology that you and I and all of us, as we all going to be patient, need. We can go to Mars. We're going to treat that nervous system as it needs to be treated. Neurosurgery, can we use it? Maintain quality of life as we age? Or are we afraid of it? Are we afraid of brains? You had brain surgery? I don't know if I should come close to you. Or would we rather live with it? I am definitely compassionate about the whole thing. Thank you very, very, very much. I did it!
Hi, I'm Dr. Engel. Well, I'm not much for public speaking, but I've experienced a lot of the symptoms that you've been talking about tonight, the pain in the leg and the arm. And I felt like before I came to see you, some of the doctors were telling me how I should feel. You know, when I would talk about the pain in my leg, would say, well, you know, they would want to hear about the pain in my arm as how it related to my spine, and the problem in my neck. So I really felt like I was having to tell doctors what they wanted to hear. And at some point I would say, well, just forget about the pain in my leg and concentrate on the pain in my arm. So I just appreciate you listening to all of my symptoms and taking it all in and,
okay.
And curing my...
Do you mind if I give a few comments about it?
Yes.
Basically, having a herniated disc in the neck, in a cervical spine, is generally causing the doctors to look for nerve root problem, and the roots of the nerves going to the leg are down in the lower thoracic. They are not in a cervical. Remember, in a cervical, it's the tracts that are going down that are going to become roots that are going through. And so those doctors' thinking is, well, arm pain, you have to be complaining mostly of arm pain. Do you understand? If you're complaining of leg pain and they don't get the myelopathic signs, remember scratching the bottom of your toe, your foot and all that? If they don't get those signs when they examine you and you say you have leg pain, they are not going to think that the disc that you have that is herniated in your neck has anything to do with your leg pain, because they cannot think outside the box. Remember, I am not here to blame anybody. The reason they cannot think outside the box is because that's what they've been taught. That's what the book says. Okay? So for them, it's dangerous territory to think outside the box, outside the standard of care, for number one. And then secondly, it took me 7 years, 7, to realize that the books were wrong, to fully get the sense that the books were wrong. So unless you're willing to go there, you'll never go there. And the centuries will pass, and what Claude Bernard, my friend, said, nobody will look at. It stays in the book. Sorry, it's in French. I'll have to translate it. But you see the thinking? And so I appreciate you saying that, because it is showing what I say all along. You had leg pain from a cervical disc problem.
Absolutely.
Anybody else?
Good evening. I was told I had multiple sclerosis and Lou Gehrig's disease. And then another doctor said I had, you just go home and get your house in order. So I came here instead. And she's pulled me through this whole thing. I don't have MS, I don't have Lou Gehrig's disease. I'm up and around and I'm walking. My talking is better. My outreach to people is better. Like right now, I'm choking up.
It's okay. I understand. I am not saying that we do miracles. Some of the patients, if they want to talk and if they don't get too emotional about it, will tell you how hard it is to get back from the bottom, from where they've been with the idea that they should be living with it. You have either multiple sclerosis, or maybe you have Guillain-Barré, or maybe you have, who knows, Lou Gehrig's terrible disease. And you have burning feet, and you're told that that's the MS, like. So anyway, thank you. Anybody else? I hope nobody is scared about the emotions here.
My name is Jim Berglund. I'm an attorney, and I've been an attorney for approximately 30 years. I had the pleasure of meeting Dr. Engel several years ago when she was treating a registered nurse who was a client of mine as a result of an automobile accident that she'd been in. The nurse had, at the time of the accident, had a brief period of neck discomfort that was not deemed very serious. She developed low back pain and sciatica, and 8 months after the accident was diagnosed as having a herniated disc in the lower back. She had surgery on that disc, and the pain in the low back and the leg that she had problems with previously seemed to get better, only to reoccur after the passage of approximately another year. When Dr. Engel met with the nurse, she gave her a physical that was much more comprehensive than any physical the nurse had previously had. She asked about the neck symptoms that had happened after the car accident and ordered an MRI. To everybody's surprise, the nurse had substantial bulging in discs at 2 levels in the neck, which Dr. Engel did surgery on, and further to everyone's surprise, the low back pain and the sciatic pain went away and have not returned several years later. In listening to this lecture, this case immediately came to mind because it was one of now several that I've seen with Dr. Engel, where she is doing an examination more thoroughly than the average physician. She is finding problems in the neck where there really aren't pain symptoms in the neck, and when she corrects the neck, the problems in other parts of the body are resolved, sometimes very quickly, sometimes over a passage of time. So to the extent that my legal experience is relevant here, I certainly commend her for her work. I would also note that in the jury trial that we had in this case, the jury awarded my client one of the largest personal injury verdicts that Northern California has had for a low-speed car accident, and this would not have been possible without Dr. Engel.
I was diagnosed with Meniere's disease, and I also had pain in my neck about the same time, pretty severe pain. And fortunately, I was rear-ended, and I had to come and see Dr. Engel. And She did the neck surgery, and the Meniere's disease went away, and I haven't had it since. And I don't know the connection, but it's gone.
Hi, my name is Sarah. I was referred to Dr. Engel by a surgeon that I actually worked for because none of my actual doctors ever thought I really had a problem. I was, as Dr. Engel said, either I was crazy or, you know, with my age, how could I have a back problem? Because, I mean, I must be some kind of drug seeker. That's what my family doctor I had my entire life told me. And that's what they told me, doctor after doctor. No one would give me a referral to see any kind of specialist whatsoever. And it was, you know, it was something, I had headaches my whole life, horrible, horrible headaches, and probably 2 or 3 times a week. And my whole childhood, it just became part of who I was. And 3 years ago now, I guess, I was in a car accident. And directly after that car accident, I had pain in my mid-thoracic area that went radiated and was all around my chest, and that didn't go away. For the next 3 or 4 months, I was in bed and in the spa, back to bed, and there were no diagnostics to show that anything was wrong with me at all. I was fine. X-rays were beautiful, MRIs in that area were beautiful, and I felt like I should have been in the hospital the entire time. I got pregnant shortly after that, and magically all my symptoms went away, and I felt wonderful. Maybe I was crazy. Maybe it just took a long time to heal from this accident. I felt great throughout my pregnancy, and my baby was about four months old when I went back to school and went back to work. It all came crashing back to me, like 20 to 30 times worse than ever. And I was working this full, sometimes overtime job that was pretty stressful, and it got to the point where I woke up in the morning and I couldn't move my hands, and they'd be locked, and I had to massage them to get them to move. And every day from that day with my hands, it went farther and farther up my wrists to my elbows. I couldn't feel and were cramped up, and then it got to my shoulders, and it got to the point where I couldn't like get up and go to work. And I mean, I was missing work all the time. People are constantly asking me, what's wrong? Are you sick? When I wasn't, you know, and like finally I went and had a talk with the doctor that I work for, and he referred me to Dr. Engel, and she changed my life forever. The moment I woke up out of anesthesia, I didn't feel like I had the wind knocked out of me, and no matter what kind of pain medications I was on, and I was on a lot of them, I always had that pain, and the drugs didn't help. The moment I woke up, I've never felt it again after that, after years of it.
Which pain?
The mid-thoracic, and the headaches were awful, but they were secondary to the thoracic pain that I had. That was what was keeping me from feeling like I can breathe, you know? And the headaches, once in a while now, I will have one, but it's a completely different than what I used to have, and I don't feel pressure, and it's so mild, and they're getting fewer and fewer, like by the week, and they're going away, and I'm almost to 100% again at 26, almost 26, and that's my story.
You said while you were pregnant, you felt good. Mm-hmm. Was that due to the extra fluid volume, or why?
It's a good question. More than likely hormonal, more than likely. But it's a very interesting question from the point of view of the fluid, because that's one of the possibility, the fact that hormones may help. The other possibility, and I'm not sure about cerebrospinal fluid circulation, and it's counterintuitive, because when somebody has a lot of constipation, that also increases your intracranial pressure. So if you think about pregnancy, there is a big, mass there. And if it is just a matter of that, I don't know. It doesn't make sense. It's counterintuitive. The other possibility that I'm thinking about is drainage of venous blood. It may be that your circulation up here is changed because of the demand of the fetus. I don't know. Although she said she was 4 months old, the baby was 4 months old when the pain crashed back, came back. So I can't explain it. I'm trying to rationalize it, but I can't explain it. This is the obvious.
I've got something to say here.
Yes.
I met you this week.
Okay.
I have 5 years ago, my best friend at 45 years old died from Lou Gehrig's disease. I nursed him for 5 years. It was horrendous. 3 years ago, I was diagnosed with Parkinson's. You have just opened up an interesting door for me. Because it's interesting that you mentioned about the neck.
Yeah.
My neck has been, sorry, I'm starting to react. My neck has been almost, what's the word, locked at the very top for the past year and a half. I have muscle spasms in my neck, and I'm looking at all this going, there's some correlation here. So I will talk with you later.
Okay.
Dr. Engel, I'd like to get your opinion on the advocacy that's necessary to change the standard of care and how people you feel can come together to do that. I'm sure that we're not the only, my wife and I are not the only ones who have experienced the insurance companies that say, you can't have this surgery or we're not going to pay for this surgery because it doesn't meet the standard of care. There's only 5,000 have been done in the world, and it's not usual and customary. How can we remedy that problem? Because it prohibits a lot of people from moving forward, and you really feel like you can't do anything in that situation.
Well, this is why I got to a book, and believe me, I don't like writing. But I am trying to find an avenue, and I am planning to put a web page. I'm planning to put this video on a web page, free access to anybody that want to look at it. I am trying to do a movement, sort of a place where people that had the surgery can talk about it. People, doctors that are doing it can feel like they're secure to talk about it. In other words, what I'm trying to do is build that standard of care. The problem right now, believe it or not, as funny as this may seem, the standard of care is based on your neighborhood. Meaning, there is a standard of care for California. I happen to be the only one that did that surgery in California. As you know. Standard of care for North Carolina. There's one doctor who has done 700 of those surgeries in North Carolina. He is continuing to be attacked. His license was taken away from him for a year. They had to give it back to him. Now, mind you, this doctor was a professor in a university, tenured professor. He is one of the doctors that caused the 180-degree flip on what I learned in neurosurgery in residency. He discovered that back in the 90s. It is, if you look in the back of the room, you will see some of the articles and the stuff that came out in a press from him, another one, and a doctor he had treated caused them to go to 2020. And, you know, reporters, they're not doctors, they don't understand. So the doctor his words were changed, edited. Sorry, guys. They were changed to say that he was curing fibromyalgia. Well, that started a revolt, basically, among the medical community. Why? Because he was basing that on what? Case studies. patient after patient after patient after patient he had operated on, and that were better and better and better. And that's the same thing I'm showing you here. Am I basing that on research, true research? Not really. I mean, I believe I am because Claude Bernard did that research. But it's, what, a century and a half ago, and nobody knows about it. So I am trying to build a momentum. I talked to those doctors and I said, what can I do to contribute, to help, to move that? And none of them wanted me to go to the public. Because they all told me, you're going to get mowed down. And I told you, if they mow me down, they're not going to shut me up. So that's why I'm talking to all of you here, and mostly my patients. But patients alone are not enough to make that movement. We need to go to politicians. We need to go to insurance companies. By the way, I have tried to go to insurance companies. I went to the local representative, 2 of the local representatives of this part of Northern California. And I told them, I have operated now on a lot of patients that had low back pain. I treated them with cervical surgery. Their low back pain went away, and they went back to work. Now, I would think workers' comp would be interested in hearing about that, because somebody that goes back to work is not costing them any more money. I mean, think about it. We got to follow the money. It's costing everybody a ton of money. Needless to say, a lot of pain. So where do we go? I'm there to ask you guys. I mean, I have done it. I have gone to the representative. One of my patients sent an email to Montel Williams because he has a section on his MS thing that says feet on fire. My patient had feet on fire. My patient doesn't have feet on fire anymore. So my patient went to the website and said, feet on fire went away. What do you think? He never got an email back. I mean, I did that to Montel Williams. I emailed. I went to representative. We need to push all together. And that's why there are doctors here. There are, whomever wants to listen to me, they will hear. The book will come out. Maybe that gets some notoriety. I plan to put part of this video on the webpage and part of it, strips of it, onto YouTube. And see if I can start a movement.
Don't forget Dr. Oz on the Oprah show.
Okay.
You gotta follow him. He gets to the public.
Sure, but that's something that's why I ask patients to be here with me. Because I can give all my theory. I can talk about Claude Bernard. I can talk about neurosurgery and neuroscience. Only a few are really educated on the subject. The patients, they don't know. They got better. That's the end result, and they're happy. So that's what it should be. So, anybody that has a suggestion?
I'm a professional patient, you could say. That's been my life. My story is too long to bore everybody with. Let's just say a good 20 years. The last half of my life has been pain, constant, never stopping. Never gets better. You don't have good days or bad days. You have days from hell, and you have days you want to die. And you live like that. And you get shuffled. And no disrespect to any physicians or surgeons, we get shuffled from doctor to doctor to doctor. We get labeled. And it ticks me off, and I'm sorry if I'm making you upset, because I can feel your, they put it in my chart, and I'm ticked off. There's probably 5 different doctors that, psychosomatic, hypochondriac, you need therapy, and I've, one shrink for 10 years, 3 doctors, 3 psychiatrists that said, can't help you. We believe you believe you're in pain. 20 years of this. I'll try and make it more succinct. Terrible car accident in 1985, and I had, they guesstimate 3 to 5 concussions. My head was trapped against the roof of the window, and then boom, 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 slapped around a few times. And that was the end of my life as I knew it. I came to later, I don't know when, and I awoke with a metal collar around my neck and strapped down by metal on my ankles and my feet. And they thought I had broken my neck. And they did all the tests. I had the best everything. And that was just the start of a miserable journey. And not a life worth living. It is devastating. Seizures. All of a sudden I have seizures. All of a sudden I have a mental illness. All of a sudden I have burning pain. Think literally. Put your feet, put your arms, put your face in a raging fire, and that's how you live your days. And if you're lucky enough to be so exhausted that you can sleep 2 hours in a night, you might get some sleep. And that goes on for years. And I'm talking 2 decades. I don't know if Dr. Dominique knows this. I shared it with their staff earlier. I was embarrassed. I don't know if I told you. I think I told you. The head imploding.
Oh, you're the one?
No.
Oh.
It explodes. Your brain is bursting against your skull. It's mind-crushing pain. There are no words to describe it. There are no words to describe to your family, to your boyfriend. There are no words. I used to try to go to sleep by pulling my hair out of my head until my scalp had scabs, because it alleviated the other pain temporarily, enough for me to maybe doze off. And that was my standard of life. And it was not a quality of life. Try and leave all the gory details out. So many, I don't know how many surgery. I had so many surgeries. Well, that's the problem, because that's what hurts. So they did 3 or 4 on this arm, and lo and behold, I have tennis elbow, and the other elbow can't lift my arm, can't move my hands, can't use my fingers. I don't play tennis, and I can't do anything. And I'm not a marathon runner, and I can't walk. I'm in bed for 4 years straight. My neighbor thought I died. And 2 years ago, I had big time brain surgery. And it scares a lot of people. It scares a lot of family. And I'm not an expert in medicine or science, but I'm an expert in pain. I'm an expert in loss. And there is a definite part that the patient has to play in this, and want to be proactive and want to be well. And I'm one of many of her patients that I had to leave my whole family. 2 Christmases now, my boyfriend and I have been sort of fugitives, because my pain scares other people. They cannot understand it. It's not because they're bad.